Students, now I'm going to talk you through giving an IV push medication. So the first thing you need to do, again, is verify your physician's order. So I'm going to look to see if I have a physician's order. I'm going to compare my patient's name. So I want to compare those. That's Joe Dunn, Joe Dunn. Make sure their date of births, all that stuff matches. And I made sure that matches. Look at their allergies. Okay. And now I'm going to verify my medication. So my 0.9% sodium chloride at 50, 0.9% sodium chloride at 50. Rosefin 1 gram IV piggyback. Rosefin 1 gram IV piggyback. Daily. So there's a mistake. The doctor's order said daily, but the MAR did not, so I need to make sure I correct the MAR. Demerol, 50 milligrams, so Demerol 50 milligrams IV every 6 hours, IV PRN for pain, okay? Demerol 50 milligrams IV PRN for pain. Okay, so that matches, all right? So we have verified our doctor's orders, just like you did with your PO medications. So I've got that verified. At this time, I would perform my hand hygiene. So I would go and wash my hands. So I've washed my hands. I come back. I'm going to apply some gloves. And Mr. Dunn has called. We went in and we assessed him, and he says he's hurting. He rated his pain at a 6. And so he is needing his pain medication, and it has been more than the allotted time for him so he can have his pain medication. So we're going to go ahead and administer him some Demerol. So the first thing I want to do is look up my medication and see what it's for. So I'm going to look it up. Okay, so I'm looking at my Demerol, and I know this is a narcotic. It's for pain, so I'll look that up. I'm going to look at what's important about my administration of this drug, okay? I'm going to look up and see how much I need to dilute it with, okay? And my drug book says it needs to be diluted in at least 5 milliliters of normal saline. So I need to make sure I dilute it with at least that. I need to push this medication over 3 to 5 minutes, okay? So it tells me my push rate. It tells me how much to dilute with, okay? So I've got that information. The doctor's order is 50 milligrams. Let me look at my vial. I'm going to look at the name on my vial, the dose, and then my expiration date. All right. So my vial says I have Demerol 50 milligrams per milliliter. So I'm going to draw up 1 milliliter. Okay? All right. So I get my syringe and my needle. Okay. Usually these pain meds are going to be a one-time use vial, so more than likely you're just going to pop the top off. But just in case, you can always clean it with the alcohol. Okay. So I'm going to be giving 1 milliliters of medicine, so I'm going to draw up 1 ml of air. Take my cap off. Insert my air. And now I'm going to draw up my medicine. Now, something you will have to be careful with, since this is a narcotic. If you have a narcotic and say the vial contains more than you need, you've got to make sure that another nurse witnesses you drawing this up and wasting the excess, because it's a narcotic. So you've got to make sure you do that. You can't just do it and get somebody to come later and witness with you, because they're not going to want to do that. So make sure that you get somebody to watch you draw it up, since it is a narcotic. Okay? I do have a few little air bubbles. Now, air bubbles are a little more important with IV meds. So we want to make sure we get as many of those bubbles out as possible. Sometimes you'll still have little minute ones. I would hold this over the trash can. Now again, if it's a narcotic, you got to be careful. You wouldn't want to just do this without somebody watching you. Okay? Alright. So I've got 1 milliliter of medication. Alright. So to keep it safe, I want to make sure I scoop. Okay. Go ahead and we're fixing to dilute. So just keep in mind that most of your facilities will have saline injections that are in a syringe. So the way to dilute this, remember our drug book said we needed to dilute with 5 milliliters of saline. So what we're going to do is get our excess saline out. So I'm going to go pour this over the garbage can. So I'm going to I need 5 milliliters, so I'm going to get my excess out of here. Okay, so I've got 5. And just keep in mind, students, that it's always better to over-dilute a medication than under-dilute it because of the way that it can affect the veins, okay? Alright. So at this point, I'm going to take this cap off. I'm going to pull back just a little bit to give me some room. Alright, remember, I've already measured my medication. I've made sure it's accurate. So now I'm going to take my medication and place it into my saline, okay? Okay, activate your safety device. If it were to be a blunt tip needle or something like that, you can always do your little scoop method. This will go in the sharps container. Now I've diluted it with saline, and I'm just going to push my air out of it, okay? And I'm going to take my cap, make sure I keep this end sterile and this end sterile, and recap that. I'm going to label this with the name of the med, the dose, and the patient's name so that I know when we go in what we've got. I'm going to go ahead and do one more check on my medicine. I've got Demerol 50 milligrams. So I've made sure Demerol 50 milligrams. Okay. I've diluted it in 5 milliliters of saline. So I have a total of 6 in here. Okay. I'm going to take a saline flush with me. I'm going to take alcohol preps. We would dispose of this along with the syringe. Again, if it's a narcotic, make sure somebody watches you waste it. I'm going to go ahead and take my gloves off. Dispose of all this. Okay, now I'm ready to go into my client's room. I've got my MAR. I've got my medications. I have got alcohol preps, and I've got another pair of gloves. Okay. Hello. My name is Tara. I'm going to be your nurse today. I heard you were in some pain. Well, I got you some medication. But the first thing I need to do is verify your identity. Can you tell me your name? He tells me he is Joe Dunn. I like, what's your date of birth? 5/2 of 50. Okay, I'm going to verify that with my MAR. Joe Dunn, 5/2 of 50, 00455 72494. So his ID band matches. Mr. Dunn, do you have any allergies? And he tells me he's allergic to codeine. Okay, I'm going to make sure we don't have any codeine. So I've verified his identity. I will go over and perform my hand hygiene. Mr. Dunn, have you ever had any Demerol before? And they tell you whether or not they've had some. So you want to tell them what to expect, because remember, IV medications are going to take effect immediately. So kind of tell him what he's going to expect. For checkoff, we don't expect you to know everything about the drug, but you will need to know that for clinical. So if you are going in to give Demerol, you need to know what kind of things you need to know their blood pressure. You need to know their respiratory rate, those kind of things. Are they awake and alert? Because if they were really sleepy, we would want to avoid that. So you need to know all these things about your medications that you're given. All right, Mr. Dunn, I'm going to raise your bed up just so I can get to your IV a little better. I'm going to do my third med check. I'm at the bedside. I've got my label. I've got my Demerol 50 milligrams IV. Okay. I have diluted it with 5 milliliters of saline. Okay. Now, when you're given an IV push medication, just like with Mr. Dunn's IV, he has a saline lock. He doesn't have fluids going to it. It's just saline locked. Now, we always have to verify the patency of our IV to make sure that it's not going to infiltrate, because we would want to make sure it's patent before we put a medication that might be irritating to the tissue. So we need to make sure it's patent. Now, if you had fluids going, you would be able to tell that just by looking at your IV, because you've already got fluids going in there. If you're not sure if your fluids would mix with your medicine, it's always a good idea to flush before and then to flush after to make sure about the compatibility. Okay, so Mr. Dunn, we're getting ready to administer your medication. So the first thing I'm going to do is swallow the alcohol. I'm going to get my saline syringe. I've got to unclamp. And now I'm going to flush 3 milliliters of saline just to make sure it's patent. Okay. Okay, so it is patent. Alright, I'm going to set this to the side. Then I'm going to take my medication. Okay. And then remember, we looked it up in our drug book and we saw that we needed to push this over 3 to 5 minutes. So you would want to get your watch and push this medication in slowly over 3 to 5 minutes. So you give your medicine. Okay, once you give your medicine, you would disconnect. If I had touched that port, I'd want to make sure that I cleaned it off. Take my saline, flush with about 3 cc's of saline behind it, and you want to push it at the same rate as you pushed your medicine. So push your medication on through the line. Once you flush behind it, then you would clamp off the saline lock. Alright, Mr. Dunn, so we have given you your medication. It should be taking effect quickly. We will come back in just a little while to check on you. You just call if you need us. Here's your call light. I'm going to let his bed back down. Alright, I would dispose of this stuff in the sharps, clean my mess up, take my gloves off, perform my hand hygiene. I would go out and I would document on my MAR what time I gave my medication and my initials. And then you'll go back in there and check on him to see how the medication has affected him.